Hi, this is Dr. Ken Duckworth. I'm the Chief Medical Officer for the National Alliance on Mental Illness. We're very fortunate to have two guests today to help us understand more about the Black mental health experience. Our guests are Dr. Donald Grant and Harold Perrineau. And I want to thank you and just start by having you introduce yourselves a little bit. How do you touch upon this experience and what do you have to say to our viewers?
Donald, would you like to start, Dr. Grant?
Sure. I'm Donald Grant. I'm trained as a clinical psychologist, but I don't practice anymore. I'm in higher education, and I'm excited to be here with NAMI today because there's so many nuances and very intense risk factors that impact mental health in the Black community. And for an organization that's led by consumers, you all are doing the work right on the ground to be able to hear the needs of the people. And so I think this is a great opportunity to share this conversation and to really get to the root of some of the concerns regarding Black mental health, particularly with Black men in this specific instance.
Mm-hmm.
And my name is Harold Perrineau. I am an actor. I've been an actor for over 30 years. Most recently, I've been on a television show on TNT called Claws, where I play a character whose name is Dean, and Dean is an autistic man, and I am here because I've been an advocate for mental health and mental health concerns in the Black community and misdiagnosing and misunderstanding it. And so one of the reasons I wanted to do this character is because I thought having a character like this in your homes every week, maybe some people will, instead of seeing it as a threat, see it as someone they understand or know, and open up the conversation that way.
And so many people can relate to, living with an autistic spectrum disorder.
Yes.
Right. And so your capacity to convey that, which is, pretty remarkable, is a way for people to identify with things. Dr. Grant, I want to start with you. It's well established that men in general are less likely to seek help and are much more likely to end up with bad outcomes like suicide. Could you take that lens and focus it more on the Black male experience?
I think that's a wonderful question. When we look at how mental health operationalizes itself and we kind of drop that inside toxic masculinity or any type of masculinity, many of us have been trained early on not to be able to access our feelings. Many boys are raised being told, you're not supposed to cry, you're not supposed to emote. And we know that crying is actually one of the biological abilities that we have to literally release stress from our bodies. And so I think that's the first thing as it relates to general masculinity. And then we have the injuries associated with interpersonal and structural racism that really even make it more challenging for Black men to really access the words or the thoughts because there may be a risk to a loss of social capital or physical capital if in fact you engage in this space and are honest about what this looks like for us. And I don't want to minimize also the systems of the healthcare world that have disenfranchised Black people across history. There's a great book called Medical Apartheid by Harriet Washington that speaks to how these things have happened. And so when we add on top of the environment, racism, and the mistrust that many of us have with the mental health community, which there's evidence to demonstrate there's some truth to it. The Tuskegee experiment was within the living memory. And even today, we don't have enough Black clinicians and we don't have enough non-Black clinicians who are culturally, empathically trained to work with Black folk. And so I think the combination of all those things together really makes it a challenging pathway forward for Black men to seek and get appropriate help.
Dr. Grant, when I'm asked in Boston, can you find me an African-American clinician for my son, for my family member? I'm literally operating on two hands, right? In terms of the number of people that I know and trust who are fabulous. So let's think about like workforce, like how do we create it so that more people want to choose this as a vocation or a calling, if you will, to be in service to the community, because obviously they understand the cultural experience in a way that even a culturally humble non-Black person will have trouble with, I
Yeah,
think.
we need people with the lived experiences, and I think that what artists like Harold are doing are kind of breaking those stigmas inside the
Hmm.
household, so that historically, there was a comedian years ago who said the only mental health disorder that's ever existed in the Black community was a nervous breakdown, and
Mm,
in reality, Uncle Johnny had bipolar disorder,
that's
had
right.
bipolar concerns. It wasn't a nervous breakdown, but because we have not always been fortunate to have language to these things,
Hmm.
somebody like Harold Perrineau who's saying, I'm going to play this character and I'm going
Mm,
to do it with integrity, and I'm going to speak to doctors and
hmm.
learn about it and speak to people with autism and parents and really bring this
Yeah,
literally positive image of this into people's households. Now people are forced to talk about it. Now you have this 9-year-old boy who sees this character and sees his friend who has autism at school, and it's not a fear thing because it's
that's
now
right.
comfortable because he's seen it in his home, and now
Hmm.
he may aspire to be a clinician, and so it
That's
starts
right.
really early.
Yeah, the modeling is important. And I just want to mention the bipolar disorder. There's quite a literature demonstrating that clinicians misdiagnose
Oh,
uh, Black men, overcall schizophrenia, undercall mood disorders. And
yep.
again, there's so much to be humble about in this line of work. I want to shift gears. Harold, I want to
Yes.
ask you about your experience of doing this role
Mhm.
and what that's meant to you personally and how you've experienced the conversations you've had with people who've seen you.
Well, thank you for asking me about it. And when I was younger, I actually have a cousin I grew up with, and he and his sister mostly grew up together because they lost their dad when they were very young.
Mm,
And he was severely autistic, though we didn't have the words for it
mhm,
at the time. We had no idea what those words were. He wasn't verbal. He grunted and moved sort of his fingers a lot, but he understood everything, and they had an amazing relationship. So, for me, when this role came up, when this idea came up, I thought it was really, really interesting for me to get in there and try to do it, and to really serve it and to serve the character as honestly as possible,
mm,
because not only my cousin, but many other men in the community, there were sometimes you'd see them, they're walking around, you go, oh yeah, there's something wrong with that dude. That's about the entirety of the language we would have at the
mhm.
time. And that to me doesn't make any sense. That doesn't, I don't have, I'm not a doctor, but I can see like there's something really, there's a person who actually needs help. And so for me, it was really interesting and important to go and talk and to be present and
Mm,
to bring this character Dean to life, to really give him a
mm,
humanity that people could understand. That's
mm.
what I like my
What was the
job.
hardest thing about portraying that character? I
Um,
like asking actors interesting questions like that because I have no acting talent of any kind. But you have to really understand it from the inside in
right.
order to be it.
I, I don't know that I understand a lot of it. I know that one of the things that happened that was really helpful for me was understanding that autism was a your response to stimuli is overly activated. I
Hmm.
understood that any kind of stimulus, touch,
Yes.
sound, auditory, that you are overly stimulated, and that
Sure.
to me was easy to relate to. So, in
Hmm.
playing Dean, I played a character who's very, very sensitive about what he wears, about who he talks to, about the attention that he can pay to a person, what he sees in a person's eyes. And so that's for me where I started off, and I gave myself the opportunity to really be overstimulated anytime someone spoke to me.
Got it.
Even the way that you're looking at me now, I could perceive it as really
Hmm.
aggressive, and have to find ways to try to deal with it myself. So as the actor,
Hmm.
kind of constantly working and moving, and hopefully that's me understanding a little bit about what it's
Yes.
to live with autism in a day-to-day basis. And
That's
that
what people do describe that, right? Their filter for stimuli
Yeah.
is impaired. I
Yeah.
want to, yeah, thank you for that. I want to switch gears and ask both of you a bigger picture question about trauma.
Yes.
Obviously, trauma is a big part of the Black male experience, and witnessing some of these catastrophically horrific videos, I think for the people in my life who are of color, has been quite traumatic. I wanted to ask you a little bit about that and how that fits into the mental health experience of Black men and what we can do about it.
It's a great question, and it's so important that we ask that question. When we talk about intergenerational trauma, we're talking about a trauma that has existed inside of our bodies for generations. And the new research on epigenetics speaks to it very broadly, and it's some amazing work. And then when you take that, it's highly activated in a setting where we're still experiencing contemporary traumas related to the exact same construct. I facilitated a call yesterday with some kids talking about racism, and a little Black boy asked, he said, well, if this was a problem and our parents were fighting against it, why is it still a problem? And it was just such a profound question coming from a 12-year-old little boy who sees adults with this level of agency that we don't have to really dismantle this. And so when you talk about trauma, it's really this chronic, complex trauma that comes from our race-based experiences. And it's now being measured in hair cortisol samples in a variety of spaces to demonstrate that this chronic trauma is having a huge impact on us. Now, I don't want to come from a deficits-based angle because in some of us, it's creating a great deal of post-traumatic growth. And we don't want to minimize that. But we also want to acknowledge the fact that for a lot of people, it's becoming debilitating. And then you add to the fact that we're consistently seeing the replay of our murder esoterically over and over and over again. I have a reaction when I watch George Floyd dying, when I watch that knee on the neck. It's a visceral reaction for me because it's activating historical trauma and contemporary trauma, understanding that it's continuing. And so for me, it's really important that we recognize that exists. And then we add the microaggressions to them, where something as innocuous as me walking into Nordstrom and not being served the way I feel like I should, that triggers the bigger pieces of the trauma when you get those microaggressions. And so it's important that we recognize that Black men and women are walking around in the world that is highly dangerous. I mean, the people who killed Breonna Taylor have still not been brought to justice. And that says something when you're traumatized and the world around you doesn't support you in fixing or remedying or even addressing that trauma.
There's no acknowledgement of the agency of the action, right?
That's a great way to put it.
Right.
So,
and can I add something?
Harold, yeah, I'm interested in your thoughts about this same question from perhaps a different perspective.
Yeah. Well, one of the things that Dr. Grant's talking about, like being able to look at it and see it on TV and empathize with it and feel it. One of those things that I've been curious about or been thinking about quite often recently is how the experiences for people like me, who not only see it on television, but have lived through this experience where the response is, oh, I remember the time when I was leaving the theater and I was walking down the street and two police officers threw me up against the wall because they thought I looked like someone, but I literally was just walking out of a theater. That kind of very personal trauma is stuff that we don't actually often talk about. And so that's why this conversation, I feel, is so really, really important, because not only what we're seeing out there, but what we are living consistently day after day after day as a whole, that maybe we can start to heal some of that. What were you calling intergenerational trauma? Is that what you called it, Donald? We can start healing some of that, because it's very, very personal for many Black men, women, children walking around right now. It's not just what we see on television, but what we're experiencing on a day-to-day basis.
Thank you.
Dr. Duckworth, I want to add two really quick things, just really quickly. If we look currently when we talk about racism, sexism, all these different things, there's two data points that we can look at in contemporary America that demonstrate what this is, right? The deaths of women and babies on the birthing tables, the maternal death rate and infant death rate of Black women and babies is a telltale sign of the level of racism. The other thing we can look at is the current high degrees of murders of Black trans women. Those create this level of intersection of homophobia, transphobia, cis privilege, toxic masculinity, racism. All those things come together, and we're seeing them operationalize themselves in so many different data points. And so when we talk about the trauma, it's oftentimes hard for people to understand how that's quantified. And there's not a lot of efforts put into prevention and early intervention. But when we look at some of these data points that exist in the world, including over incarceration of Black and brown men, we see these traumas being presented. Now, I'm going to add another really quick point in before you move to your next question, is we oftentimes talk about the trauma associated with being oppressed. But what we don't often talk about is the trauma of existing in the role of the oppressor over generations. And so when you look at old pictures of lynchings, you're seeing 11-year-old girls standing at the foot of a Black man who was set on fire and hanged from a tree. I have a 10-year-old son. He would pass out if I took him to something like that. And so what we don't talk about is that intergenerational experience of trauma for white folk who have been identified in this oppressor role, and that the fact that that little girl standing at the foot of that lynching is now the grandmother of a college student.
Right.
And so if we really want to talk about dismantling the risk factors that impact mental health for Black men and women, we also need to talk about the individuals who purposefully or not purposefully create injuries for us that make it more challenging to remedy the ills of history and the contemporary injuries. So I think that's a really important point to make.
Very important. Thank you.
I wanted to ask you to define epigenetics. Just for our audience, I know the concept involves the impact of environment and biology, but I wanted you to develop that because it's a very important concept.
It is. It is. We historically didn't know that trauma lived inside of our DNA. We knew it impacted our body. We have some great research on that. But through the research on indigenous populations, we've learned that DNA, not the structure necessarily, not the nucleotides, but the performance of the DNA is impacted. So when individuals experience trauma, it creates these additional folds in the DNA that are oftentimes called reconstructed areas. And that impacts how the DNA presents itself to talk about hormone production or distribution in the way that a quote unquote neurotypical person would operate. For instance, with re-regulation, the DNA would prompt something to happen to bring in those dopamine molecules inside the synaptic space and say, okay, the threat is gone, you're cool now. Epigenetics may make it such that the DNA does not direct the hormone process in that same way. And what research is showing now is that historical experiences with trauma can create those epigenetic folds that result in a different functionality of the entire body. And it's so frightening to watch. We see what's happening with our First Nations brothers and sisters, and we look at the substance abuse, all the outcomes, and they're highly related to the history of trauma that the colonists placed on them during colonization.
Right. So in mental health, we've wasted a lot of time. Is it nature or is it nurture? And of course, the answer is it's both.
Right.
That it has to be both. That environment impacts biology. Biology impacts environment in some cases. And you're making the very important point that the historical discrimination, racism, and trauma is also a feature of this equation.
Yeah, but think about the number of Black men who have mental health concerns that are murdered on the street by police officers or other entities because there has been no images of like Harold just said, he wanted to bring humanity to this character. And I'd love to hear a little bit more about that thought,
Yeah.
because the reason why so many people are dying from white supremacy in the streets, and I use white supremacy very specifically because those tropes are what lead us to not seeing Black men in a variety of ways. And Harold plays this character with such compassion that it's going to force somebody to think twice about how they treat a Black man with a mental health concern or what they see as a mental health concern.
Yeah, Harold, let's develop that idea just a bit
Right.
before we close.
Okay.
How do you think your portrayal is helping people break up a trope, right? Break up a preconceived notion.
Um, yeah. I have a bit of a long answer, but not too long. So
We'll take it. We'll take it.
I'm a kid who grew up in Brooklyn. I grew up in a very a mostly poor African American part of Brooklyn, and I went to a college in Virginia, in a very small town, and I was introduced to things that I hadn't ever been introduced to before. Literally things as simple as someone living in a house where I lived in an apartment, like those things. And quite early on in my career and in my life, I realized that once you get to know something or you get to know someone, you suddenly have a new understanding about that thing, a very personal understanding about that. And one of the reasons I love being an actor and doing some of the things that I do is because I like to take the things that I've felt from people quite often when they consider me a little less than human, is I like to turn it around and then introduce them to a human being that they'd love to hang out with, to a human that they wouldn't mind being in their living room every day. And then the hope is that you start to see these human beings in a wide array in a wide variety of circumstances, and you can relate to them. And so that's really what I was hoping with Dean. I was hoping that, you'll see somebody maybe having some sort of episode, and you won't think, oh, that's a violent man. I remember,
Right, there it is.
that
Right.
Dean is overstimulated, and he's probably not trying to hurt anybody. He's probably not really sure how to deal with what's happening to him. Maybe I don't want to shoot. Maybe I don't want to call the police. Maybe I don't want to assume that he's going to hurt me, and maybe I can actually even help. And so that's been my idea as an actor, and my idea specifically for this character. Like bring some kind of humanity in your living room, right where you sit. And that's hopefully what we get a chance to do weekly.
That's a great answer. And the literature on how we break down our stereotypes in the mental health field is contact with people makes a difference.
Yes.
Yep.
Connecting with someone who has something that you have a preconceived notion about, schizophrenia, bipolar disorder. What does a person with OCD or autism look like? And the contact, it's like, oh, that person's actually a lot like me. Right. And from a diagnosis point of view, and you're making the same point,
right,
that, if you can really take in the person, you'll be different at the end of the transaction.
Right. And can I say this before you?
Yeah, please.
I'm so glad about groups like NAMI, and I'm so glad that we're having this conversation. And I really just hope that people really take the opportunity to use your services and go and find and get help and feel like it's okay to get help. I'm just so glad that NAMI is around, and that it's that it's been around since 1979 or something. And,
yeah, we're on our 40th year anniversary. So
I'm just glad you're there, and really I hope that people come, use your services, donate money, and do all. You really are. It's really a great thing that you're doing out in the world for Black people, for non-Black people, for the community of mental wellness.
Thank you for saying that. One of the pieces I want to add to that is many people experience the service system as fragmented, chaotic. State hospital beds are being closed. We over-incarcerate not only Black males, but African American who have mental illnesses and non-African Americans who have mental illnesses, right? Correctional centers are big parts of our mental health system. One of the beauties of NAMI is that we support each other as a peer community. That doesn't mean you shouldn't try to get a good doctor. That doesn't mean that there probably isn't a treatment that might help you. But the point is, while you're working to find that elusive thing in an underfunded, chaotic, and I have to use the word system in quotation marks, right? You cannot feel alone. You can
Right.
feel joined and connected with people who get it. And that's the beauty of NAMI. And I thank you for saying that.
Yeah.
Before we close, I want to ask each of you to think about a message. You like people who took the time to watch this conversation. What's your message for the audience? And it doesn't have to be a tiny answer, you know, as we've discussed, Harold, because that long answer was a beautiful answer. Let's start with Dr. Grant.
I echo everything Harold just said as well. My message for the audience is twofold. And the first component is to really look at how our behaviors negatively impact the mental well-being of other people. Understanding that nothing happens in isolation and everything is a part of a system. When we look at what's happening right now in the world with anti-Black racism, it has to be understood that this is a part of a wellness thing, and it's not creating wellness in Black families if we consistently deny the existence of this system. The second thing is that I would encourage Black people to activate resistance against the stigmas of mental wellness. It doesn't mean that you have to go to a quote unquote therapist. You could reach out to an organization like NAMI and get some peer support. You can do yoga, you can exercise, you can meditate, but just pay attention to the fact that you don't go to your minister to get your insulin, you go to your medical doctor. Right. And so in that same way, we want people to engage in activities specifically aimed at supporting mental wellness. And we want Black folk to feel comfortable doing that, because we know that legislation and adjudication puts Black people disproportionately with mental illnesses into the criminal justice system, as you just described. When we have depression and anxiety at early on, they're diagnosed as oppositional defiant disorder to pave the way to adjudication. And so I want us all to pay attention to the intersection of racism and mental health so that we can allow our communities to heal more successfully, efficiently, and effectively.
Thank you, Dr. Grant. Harold, I think you're going to get the last word here. And
okay, well, I want to echo everything that Dr. Grant said. I think everything he said is absolutely on point. And the thing I would love for people to take away from here, I was having a conversation with another actress on our show. Her name is Jennifer Lyon, and she was talking about, us taking our mental health and our mental wellness and considering it probably last on the scale of everything we need to do. What if we actually considered it on the scale of the first thing we need to do? What if we used it actually as a tool of actual defiance against the systems? If we actually worked on our own mental health and the mental health of all the people around us, what would that look like? And so what I would really encourage people to do is really consider to taking the time to work on your own mental health. Just like Dr. Grant said, you can do yoga. You don't have to go and see someone. You don't have to see your priest. You can have a conversation with your friend, or you can actually seek help from other peers, from professionals, or whatever that is. And maybe in that is a fight, a resistance fight all in itself. And so that's what I would like people to do. Really.
So you both made the point, you have to consider it, think about it, and then connect with others.
Right.
That's right.
Whether it's a professional, whether it's a peer, whether it's somebody you love, the idea that making the conversation safe for yourself and in connection.
Right.
And it's deliberately about your mental wellness.
Yes. Intentional, right?
Intentional, yes.
Well, I've loved this conversation, and I hope we can stay in touch. I want to thank you both for your wisdom and your generosity with this conversation. And I'm going to ask NAMI how we can stay in touch with you, because you're both leaders. And as the nation is having this conversation in ways that I hadn't seen before, I'm just very grateful to the two of you.
Thank you.
Thank you.
Thank you. All right. All the best.
But take care.